With the recent midterm elections ending, there was certainly no shortage of misinformation out there. In this video, I'm going to talk about some of the misconceptions when it comes to TURP, also known as roto-rooter of the prostate. And for those of you who don't know me, my name is John Lin. I'm a urologist in Gilbert, Arizona at Sunrise Urology. As always, if you have any questions or comments during this live stream, feel free to leave them below, or if you're watching this on replay, feel free to leave any comments and questions, and I will try my best to answer them. Although I am a urologist, I'm not your urologist, so I'm going to state a disclaimer that everything I say is not medical advice for you, but in general, we can talk about BPH, enlarged prostate, and TURP. So let's get right into it. TURP, also known as transurethral resection of the prostate, has been regarded and is the gold standard when it comes to the treatment of guys with enlarged prostates and with urination problems due to an enlarged prostate. There are new technologies out there. Everything that comes out is compared to TURP. It is extremely effective with patients needing retreatment of this enlarged prostate method in about 10% of the time in 5 years, meaning 90% of the time in 5 years, you do not need additional treatment. For most of my older patients, I tell him that once I do this procedure for you, most likely this is going to last you for the rest of your life. You don't need to take medication anymore. Your prostate is going to be wide open, and you're going to be able to void like you're 18 again. Some of my most grateful patients are guys with enlarged prostates, and I fix them using this procedure. They are extremely happy because it regained their quality of life. They no longer are having to go to the bathroom on a regular basis. They don't no longer have to look for a bathroom everywhere they go. You may have a problem if you know where all the bathrooms are wherever you go. The grocery store, Home Depot, Target, Costco. If you know where all the bathrooms are, there may be a problem. So definitely look into it. This is something that you do not have to endure as you get older. A lot of people tell me, "Oh, this is just part of aging." Yeah, it is part of aging, but you do not have to suffer with these urinary symptoms. There are about 40 to 42 million Americans with this enlarged prostate problem, and most of them are not getting treatment. Medications are Band-Aids. They kind of make you feel better, but they don't treat the underlying problem, which is an enlarged prostate blocking the flow of urine. And that can lead to all sorts of problems such as bladder infections, bleeding, sometimes damage to the bladder, so the bladder no longer works, meaning you have to put a catheter or a tube into the urinary tube to drain your bladder multiple times a day, or wearing a tube draining your bladder all the time, either through the lower belly or through the urinary tube. That is not very good quality of life, if you will. In rare instances, I have seen guys who have had urinary retention for so long that they ended up causing back pressure up into the kidneys, and they ended up with kidney failure because of an enlarged prostate. So there are a lot of consequences due to an enlarged prostate. And prostate, I don't really care too much about the prostate. Prostate is nothing but a liability. I worry more about the bladder, because bladder stores urine for guys, and urine has to go from the bladder through the middle of the prostate out the rest of the urinary tube. And sometimes that prostate grows outward and also grows inward like this, closing off the channel. And that is when guys have these urinary symptoms, such as feeling of incomplete emptying, frequency of urination, having to run to the bathroom when the urge hits, straining to urinate, poor stream, getting up at night to pee. These are some of the most common symptoms when it comes to enlarged prostate and urinary symptoms. When the patient is appropriate, when the prostate is appropriate, TURP is a very, very effective option. So when I talk to the patients about TURP, they frequently have these questions, and I want to address some of them because there's a lot of misinformation out there. They may have heard, "Oh, my buddy had this done and X, Y, or Z happened." Well, I'm going to tell you, in my hands, when I do this procedure, this is what happens. Don't trust what you read online. Hear it directly from the horse's mouth. And again, if you have any questions, leave them in the comments below. I will try to answer them live during the Facebook live stream, during the YouTube live stream, or I will answer them if you're watching this on a replay, and I'll answer them afterwards. Okay, TURP. First of all, it is covered by Medicare and most private insurers. We don't have a problem getting this procedure covered by insurance so that you can have the procedure done. As a matter of fact, they probably gladly cover you for this procedure because it cures you of your urinary difficulties. You no longer have to keep coming back, visiting your urologist. You no longer have to worry about bladder infections, bladder injury, and you no longer have to keep taking medication. Often, patients are on one, sometimes two different medications for an enlarged prostate. Well, as soon as I do this procedure, both medications are eliminated and you are actually getting a mechanical de-obstruction of your prostate. So your stream is going to be extremely strong. The frequency and urgency will also improve. So yes, it is covered by Medicare and also private insurers. That's never been an issue for my patients here in the office. A lot of patients are worried about recovery from the procedure. And when it comes to recovery, it can vary. For instance, the guys who are older, who have been suffering with these urinary symptoms for a long time, it will take a long time for them to recover, if you will. Meaning the frequency of urination, the urgency of urination, the getting up at night to pee, those are called irritated voiding symptoms. The longer you suffer without treatment, the longer it will take for you to get rid of those symptoms. Some of it is behavioral because you're used to peeing the way you have been peeing. So you expect that I have to get up at night. I have to run to the bathroom. I always have to look for the closest bathroom. So a lot of it is habit. And the longer you have that habit, the longer it takes for you to break yourself out of that habit. Does that make sense? So recovery is variable. In addition, some of the other things that you may experience during your recovery is you may have the urgency to go to the bathroom and you can't make it there. And that improves over time. Also, during your recovery, you may see some blood in the urine that is intermittent, not all the time. If it's all the time, then we have a problem. But usually after the catheter comes out, you are voiding with blood in the urine on and off for sometimes days, sometimes several weeks, but it lets up over time as your bladder, as your prostate heals. In addition, burning with urination. Because this procedure is done without cutting from the outside, it's done through the urinary channel with a small telescope under general anesthesia, meaning you're completely knocked out. You won't remember a thing. Because we are going through the urinary tube with a small telescope to perform this procedure, you may experience some burning with urination after the procedure. And generally, it does not last long. Generally, you do not need narcotic medication. So if you're worried about addiction, or if you're worried about abuse, if you're worried about constipation, generally, you don't need narcotic pain medication. I generally prescribe a medication that turns your urine orange, that coats the urinary tract to numb up the urethra, the urinary tube, so that you are not having to suffer from this burning with urination. After the procedure, I also send you home on a few days of antibiotics just to make sure that you don't get an infection. On the day of the procedure, you do receive a dose of antibiotics intravenously, so you don't need to take an antibiotic that day, but just for the next few days, I prescribe antibiotics for you to take to minimize the risk of infection. So it is done through a small telescope, no cutting from the outside. You are completely knocked out under general anesthesia, and is a 1 to 2 hour procedure. Typically by the time you get out of the operating room, maybe an hour and a half, hour and 45 minutes, depending on the size of the prostate. So it could be as short as an hour, depending on the size of the prostate, depending on the amount of bleeding that I see that I have to manage. So by the time you get out of the operating room, typically the catheter that's draining your bladder is crystal clear. Very, very clear, meaning there's no active bleeding. And that is part of the reason how I'm able to perform this procedure. Unlike other people, I'm able to perform this procedure as an outpatient, meaning you go home the same day. Now, you may be reading online saying that you have to stay in the hospital with a catheter inside you in the hospital with the water running in and running out of the catheter for several days or at least overnight. The way I perform this procedure, no. You get to go home the same day for 99.99999% of my patients. And I may take a little bit more time in the operating room because I make sure that all bleeding points are addressed, that the catheter is draining perfectly clear before you get out of the operating room. And that is how I'm able to get you home the same day. And also, that's part of the reason how I'm able to keep the catheterization time so short. Unlike other people, everybody does it differently. Unlike other people, the catheterization time is only 1 to 3 days. Most commonly, less than 24 hours. Meaning you're coming into the office and we're taking that catheter out in less than 24 hours. So despite what you may hear, no, it is not an inpatient procedure. You actually go home the same day. And number two, the catheterization time is extremely short, typically less than 24 hours to 3 days, typically, maximally. So unless there are some unforeseen mitigating circumstances, the catheter is also removed in the office. Rarely do I have a spouse who's a nurse who feels comfortable removing the patient's catheter. Most commonly, patients simply come in to the office and we take the catheter out. So you don't have to worry about having to read some instructions and try to remove that thing yourself. We will take care of it unless you feel comfortable taking out the catheter. Something else guys always ask me, well, how long am I laid up after this procedure? You are not laid up at all. Even with the catheter, you can move around. I mean, I don't want you to be doing a foot race or something like that with the catheter in or shortly thereafter, but you are not laid up during this recovery process. You can move around the house. You can do anything that you can tolerate while the catheter is in place. And as soon as the catheter comes out, you're going to notice, well, I don't have anything tethered to me, so I can go to the bathroom. I can walk around much easier. Even though you're going to feel great, refrain from overdoing things, because if you overdo it, you may end up having some bleeding, and we may end up having to deal with that bleeding issue. Okay. Something else that worries a lot of men. And for my dad, this was his big complaint. He actually had an enlarged prostate many years ago. He ended up not being able to void on his own, meaning completely stopped up, not being able to go 3 times. That's right, 3 times before he finally had a TURP. He had to wear a catheter, had a catheter replaced 3 times before he finally had a TURP. And I asked him, Dad, why did you wait so long before you sought a cure? I mean, he tried all known available medications at that time, and none of it worked for him because he was too far gone. I said, why did you wait so long? And he was worried about urinary incontinence, meaning not being able to control your urine, and you're voiding on yourself, you're leaking on yourself after the procedure. Most of the time, urinary incontinence after the TURP is temporary, meaning you have had an enlarged prostate for a long time. Now that I de-obstruct, there's no more blockage, and now you're depending on yourself and you're not relying on an enlarged prostate to hold your urine back. So you may experience some urge incontinence, meaning as soon as you feel the urge to go pee, you can't make it to the bathroom. Typically, that improves over time. I have not had anyone with permanent urge incontinence. It's only temporary urge incontinence after the procedure. So most patients do great without any problems. When done appropriately, typically there's no permanent urinary incontinence. So I want to just reassure you that it is an extremely safe procedure. My dad had this procedure. He did not have urinary incontinence despite his worries. So he did great. And he's 92 years old and enjoying his urination, even though because he waited so long to have treatment, he was fixated on his urination, but now he's no longer worried. All right. So one of the things that can happen after a TURP or Roto-Rooter is something called retrograde ejaculation, meaning when you have orgasm, semen no longer goes out. Instead, it goes back into the bladder. Now, I tell my patients that I can guarantee that this is most likely going to happen unless you want me to perform this procedure in a way that will try to preserve the ability to ejaculate out instead of having it go back into the bladder. So that procedure is called ejaculation preserving TURP. Ejaculation preserving TURP. And it can be done, not 100% successful, but it can be done if having semen come out is of concern to you. Some men are fixated on that. Most guys, by the time you have an enlarged prostate, you're usually older. You don't care about having semen coming out because are you trying to get someone pregnant? Or the other reason that you may care about semen coming out is that if you are in the adult entertainment business. So I warn patients that, yes, unless you're trying to get someone pregnant or unless you are in the porn industry, most guys don't care about semen coming out after a procedure. But there are ways to mitigate that problem, meaning I can perform the procedure while trying to preserve the ability to have semen coming out. It's called ejaculation preserving TURP. So if that's a concern, if that's something of interest to you, certainly let me know, and I'm happy to set it up so that we can do ejaculation preserving TURP. All right. Let's just say you're 65, you live another 30 years, and over that time, after a TURP, over that time, your prostate grows back. How do you treat that? Some guys do have that problem, and sometimes prostate regrowth can be pretty fast, and they require additional treatment. And you may be wondering, well, what are my options if my prostate grows back? Well, all the treatment options remain available. You can try some of the minimally invasive procedures. You can have a repeat TURP. You can try medication. All the other options are available to you, so that is not a concern when it comes to TURP. And recovery afterwards, should it regrow, you have not lost anything. You can still have any sort of procedure done currently available to treat that enlarged prostate regrowth problem. Okay, I've already told you that this is a very durable procedure. It lasts a long time. Retreatment rate at 5 years is only about 5 to 10%. Extremely low, extremely effective. That is why this is called the gold standard. Gold standard. Lastly, I want to talk about my experience in performing TURPs. Let's just say that I have done a lot of these procedures. And if you want to see before and after photos, I have tons of them that I can show you on my phone. This coming Tuesday, I have 5 of these procedures on the schedule. So I have done a lot of these procedures, and that's how I'm able to tell you this is typically what happens to my TURP patients. I have done enough of these so that I can do these reliably and predictably, so I can tell you typically what happens after a TURP, as I'm doing in this video. So rest assured that I've done a lot of these TURP procedures, and I would have to say that I'm pretty good at doing them. Patients are extremely happy with these procedures. All right. Well, happy Veterans Day, everyone. Today is Friday, and every Friday, believe it or not, us here at Sunrise Urology, we wear red, and red is to remember everyone deployed. We think about our military personnel as well as the families of the military personnel every single Friday by wearing red. As always, if you have any questions, comments, suggestions, agreements, disagreements, controversial issues, feel free to leave them in the comments below. Thank you so much for watching. Thank you so much for the privilege of your time. Take care of yourself and take care of each other. Bye-bye.